It is 5 o'clock, and we are going to start oh my gosh, the things you learn. The meeting of the Indian River County Hospital District, our April meeting. I welcome everybody that's sitting out here, as well as anybody that's on the phone tonight, okay? Ms. Tracy, would you like to do the invocation? Sure.
Weird coming all the way down here. All right. I wanted to read from Ecclesiastes 4:9 that says, "Two are better than one because they have a good reward for their labor." When individuals work together, they can double their strength and get much more done as a team. They also reap the value of having worked in unison, thus creating harmony instead of disorder. Working as one people begins with the efforts of each person as they work with another person. And I felt like this was a good way of explaining how we as a board are working and being in collaborative effort with a lot of the organizations. It gives us a good opportunity to build relationships, not just with our community, but also with the different partners that we support. And it opens up other opportunities as we move forward and work on collaboration to work with other government agencies and new organizations that maybe we haven't worked with before in relation to healthcare and furthering that in our community. So with that, if you would join me in prayer. Dear Heavenly Father, thank you so much for the opportunity to come before you. I ask your blessing on this meeting, on each and every person here and those that are watching. I pray that you would give us wisdom to do your plan and your purpose for this community, and that you would be pleased in all the efforts that we do in your name. Thank you so much, Lord. In Jesus' name, amen.
Amen.
Thank you, Tracy. Michael?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you.
Thank you.
I would say this month has been a little bit of a quiet month for us, but we are going to be gearing up again here soon. We have the RFP coming in May 8th, I believe it is, for the Gifford Health Center. And then we also are beginning our budget series for the 2019-2020. Yeah, I know, year. So we'll have a busy time coming up here. So with that, we have the consent agenda. The approval of I would like a motion for approval of the chairman's meeting minutes dated March 20th, the regular monthly meeting minutes dated March 21st, the special meeting minutes dated March 26th, and an April disbursement of Mr. Jones.
$1,125,799.28.
So move.
Second.
Is there a second? All in favor?
Aye.
Okay, moving on. The district council report.
Thank you, Madam Chair. Again, it has been a little bit quieter of a month, but there's always multiple things going on at the district. I attended this past month the Partners Collaborative meeting and worked with that group and reviewed the minutes following the meeting. Also, I attended the April Gifford Health Council meeting as we are continuing to work towards finalizing matters concerning the Gifford Health Center and our RFP that is out for response, with responses due back, I believe, the end of next week. I've also been reviewing information regarding the district's upcoming budget cycle meetings that we'll be having this coming month, and materials related to that, as well as responded to questions from each of you as they've arisen over the month on various matters. And one thing I failed to include on here, but recalled this morning at our chairman's meeting, is that I've been working on an overview of Robert's rules regarding how we as a board utilize those rules and how they're referenced in our bylaws. So that came out of the discussion we had with regard to our strategic plan and the education component, which we touched on a little bit this morning. So I will be giving you that presentation at a later chairman's meeting when we can fit it in. We do have a couple things, as our chairwoman mentioned, coming up this coming month. So stay tuned for that. Any questions?
Okay, thank you. Our financial statement review, Mr. Jones.
Well, the district remains in solid financial condition, so you can rest at ease. Our bank account contains just under $10 million, less than $1,125,000 we just spent. So that leaves a little less than $9 million, with about $7.7 million budgeted for the balance of the year. So that leaves enough to cover all of our anticipated expenses and fund most of our budgeted $2 million in reserves. But in addition, we still expect to receive about another $1 million in tax revenues that will be coming in between now and the end of September. And the healthcare providers are running at a rate that's less than the total amount that we budgeted. So when you put all this together, it projects to very sufficient funds for our needs. I'd also, just for the public's note, this morning at the chairman's meeting, the trustees approved a recommendation to transfer our bank accounts and accounting services locally, following the guidance of our auditing firm, Morgan, Jacoby, Boyle, and Thurn. This will provide financial services for the district that we anticipate will be a little more timely, certainly very accurate, and at less than half the cost than our current expenses. So it looks like a win-win-win. Oh, I should mention one other thing. In the amount of money that you approved earlier, the $1,125,000, that included $60,000 for the FEMA report on infant mortality review. If you remember, we approved that in two stages, $30,000 this year and $30,000 next year. However, they've already been paid $60,000. So we won't have to worry about that next year. But I just wanted you to know that is a little bit higher expense than we would have normally expected, but it doesn't matter. We're in great shape.
And do we know when we'll see some information relative to that?
I would expect that something after the first of the year. It's going to take them a while to gather all this information. I haven't gotten a precise estimate yet, but Andrea Berry of Healthy Start is the one that's really going to do the heavy lifting on this with the assistance of Miranda and the Health Department. But the core functions are going to be conducted by Healthy Start, and they've already begun. But I think it'll be after the first year before we get that. That is a study, incidentally, on infant mortality. As you recall, that the last one that was done in Indian River County was over 10 years ago. And because we don't have a lot of births per year, 11 to 1,200 per year in the county, they need to aggregate data over a period of years to really analyze it so that you don't really violate HIPAA or any other privacy information. So this is overdue. We're glad it's going to be done. It's unfortunate the state didn't fund it, but I'm glad we did.
That's good. Any comments, questions for Alan? Okay, Executive Director report, Anne Marie.
Oops. Okay. In your packet is my report, which I think I've covered most of the activities that have been that I have been involved in over the course of the month, and maybe a little bit more in some upcoming activities. So you can review that. I did want to mention a couple of other things that, one, I failed to put in there, and one about an event. So yesterday, the Junior League had their annual Woman of the Year luncheon. That event happens annually, and it recognizes women in our community that in 4 different categories. Those categories are business professional, civic nonprofit, professional, volunteer, and rising star, which is a young group of people, individuals, girls that in our community that are already moving and shaking. So it really is a good opportunity to recognize those in our community that for the things that they do, the contributions they make to our community. So for those of you who don't know, we, the district, did nominate our very own Mary Beth Cunningham. We talked about this morning a little bit at our chairman's meeting, and she's giving me the evil eye. But she obviously has made many contributions and continues to make many contributions to our community, supporting
work for children, education, philanthropy, and most of all, as you know, for bringing the Cleveland Clinic, initiating and bringing the Cleveland Clinic to our community to manage and operate our community hospital. An impressive piece of that was the attendance of 20 of her friends from the Indian River Club who came there to support her and be there for her, and so we thought that was pretty exciting. So we thank them for attending that event. And although she was not named the Woman of the Year for this year, she is our Woman of the Year, and so I think we all agree that those contributions that she's making has made it a better community for us, so thank you.
Here.
Mary Beth.
Thank you.
And we're not going to talk about it anymore, okay?
Thank you.
A couple of things I did not mention in my written report were the fact that we are tracking a number of House and Senate bills that are moving through the legislature right now. A couple of interest, and I have the information on those. Kate tracks them, Jennifer tracks them through her office as well. A couple that may affect us that are still, with only a week left, I think, in the session or so, are still alive and moving through. So one of those is the ethics reform that we had last year that did not pass, that did pass for most bodies like ours, but for independent special districts, they were not required. You all, as elected officials, were not required to follow that ethics training, which is a 4-hour training that would happen annually. And so they have reissued that for this year, and that very well may pass. So if that happens, I will certainly keep you abreast of how you can comply with that, and maybe we can do a group training so that you can all attend at the same time or something like that. So I'll keep watching that. Another was local government fiscal transparency, so that seems to be still being heard, and another on telehealth. So those are affecting us and important for us to continue to pay attention to and watch, and so I just want you to know that we are doing that. The other thing I did not mention, and just very briefly, that they did have the marijuana forum, which I was asked to attend, and many of you wanted to, and that was held on a day that was not. So I do have the PowerPoint for that. It was a 4-hour session. There were a couple of our organizations that we work with closely in the community. Brett was there, and so it was really about the legalization and what to expect more so than, and how it has impacted those states that began with medical and then have transitioned to recreational, and what it does for public health, public safety, good and bad. I mean, there are pros and cons to everything, and how that legislation passes. So I'll forward that PowerPoint of the items that they talked about, and if you have any questions or want me to expand on that, just call me and we can talk about it. Otherwise, I think that's it.
Okay, any
questions?
questions or comments for
Thank you.
Emery? Thank you.
Mm-hmm.
We'll move into our funded agencies reports. So I believe, Brett, you are up first with the Connection Center.
Good evening. Thank you for having me here tonight to talk about the work that we're doing. Things are going very well. We continue to support the collaborative. We just continue with the initiatives that we've started in years past and continue with, for example, supporting the Mental Health Court initiative under the leadership of Judge Cox and Sheriff Lohr. We continue with our joint agency team meeting, and that has brought together 35 organizations in town that meet on a bi-monthly basis just to sit and talk about what is new and what is going on, and connecting and making sure everyone is aware of what's happening in our community and how we're linking people together. We started the initiative of bringing our solo practitioners to town, or in town, together. They had never had a forum to meet together, and we held our first meeting about a year ago, and it was me and 2 clinicians that sat and looked at each other for an hour, and it was really not very exciting. But our last, since then, we've connected with 28 practitioners in town that have never sat in the same room before. They officed a mile from each other and didn't know each other existed. So that's been really great. It's great for referrals, it's great for linkage, who's doing what specialty and how to hand off patients that aren't of their particular clinical expertise. And we are able to offer them, I've accepted the co-chair position for the National Association of Social Workers, the Treasure Coast chair. So what that does is it harnesses the statewide NASW so we can offer CEUs, continuing educations, to the clinicians in town. And we've organized, I've organized a program where if our clinicians in town present to the other clinicians, then they get all their CEUs free for the next 2 years. So it just continues. Everyone can get their continuing education at little or no cost. So it's
Are all
working.
those CEUs for each specialty, can't be all the same? I mean,
No, I mean, these are social workers, but it
Okay,
qualifies
social-
for all mental
okay,
health
got
professionals,
it.
psychologists,
Right.
licensed mental health professionals, et cetera.
okay, and they're all grouped?
Correct.
Okay.
Yeah, they're the same CEUs apply.
Yeah, okay.
Yeah, not just social workers.
Are
Yeah,
you
but
doing
it's
it
all
at
the.
the Connection Center?
I'm sorry?
Are you holding those at the Connection?
Yes, in the collaborative.
That's
That's
wonderful. That's
Yes.
great.
So we have offered one so far. We had 35-ish participants. We offered 3 CEUs. Our next one is in May, so we're going to start doing about every other month or quarterly CEUs. So really, if you stay on our schedule, the clinicians in town will never have to pay for another CEU on their renewal process.
And go somewhere else.
And
We used
exactly.
to do that for nursing in this community too, but that's gone. And it's, you have to go online or do it. And interaction, I think, is wonderful.
Absolutely. And with the NASW partnership, I can bring in folks from all over the state that will come down and present.
I think that's so wonderful.
That's really good.
Yeah.
Congratulations on that piece.
Thank you.
Yeah.
It's been very exciting. And, my next plan for that, because, I'm always hatching a plan, is the next will be medical education credits for psychiatrists, because what
Of course,
psychiatrist
yeah.
doesn't want to come to Vero Beach in February every year, right? So now we can attract psychiatrists here to do their continuing education, and, I can
Maybe they'd stay.
tour them around so they'll never want to leave,
That's,
We'll turn it into the Hotel California, so we so.
that's wonderful.
Yeah, so that's a work in progress. We'll continue on that. A new committee that we formed this year that came out of our membership meeting was building community awareness. Now that is a wide-ranging topic, and we have subcommittees of that group. And we're working on a stigma campaign. We're working with a local organization that has a really excellent stigma campaign. I'm meeting with them next week, and we're hoping to launch that out in the community. So that's going to be starting. Mental health awareness activities. May is Mental Health Awareness Month in the United States. We're doing a proclamation in May for that. Internationally, Mental Health Awareness Month is in October. So we have a big event planned at Riverside Park, our first annual. So more details to come on that. We're continuing to push on our initiative with Mental Health First Aid, and I think we've talked about that before. Mental Health First Aid is the CPR for mental health folks, and the mission for that is to train as many people in mental health first aid, which it trains lay people how to identify signs and symptoms of mental illness and substance abuse, how to have a non-confrontational conversation with that person, how to make sure they have access to services, and how to ensure safety. So if we can train as many people in mental health first aid as are trained in CPR, our goal is to train 25,000 people in Indian River County in the next 10 years. So we're pushing forward on that initiative. And then we're continuing to follow legislation. Oh, and then we do this little thing called the McCabe Connection Center, which is lots of fun. So we've now seen more than 2,500 people in this county in the last 26 months. So we're pushing almost 2% of the entire population of this county. We were seeing on average of 92 to 95 people a month. That is up to 115 people a month, so it continues to grow. I just didn't think it would, but it continues to grow. February, a short month, was the 4th busiest month we've had since going. The referrals continue to come in from a variety of sources, and we continue to place them with all of the different providers in town. As you remember, one of our goals was to, or is, if somebody needs to see a psychiatrist within 5 business days, or they'll likely end up in the emergency room or inpatient psychiatry, we work to get them an appointment within 5 days. We have been successful 131 times in doing that, so keeping people out of higher end services. There was 2 that we failed at, but we got them in within 8 business days. So there's room for improvement, and we'll work on it. So that continues to go well, and our patient satisfaction is just through the roof. People are very happy with the services we're providing, just great outcomes. Our benefits specialist, who can do hospital district assistance applications, but also does, we're a partner agency with DCF, so does Medicaid, food stamps, Medicare, Social Security, disability claims, and you know that is quite the process. She's averaging a acceptance every 10 days now, so it's just going really, really well. She's very good at what she does. But don't tell anybody because we don't have a lot of open slots. So, but no, it's going well. I mean, just the outcomes continue just to exceed even my own high expectations.
That's
Great.
awesome.
Congratulations.
Right, thank you.
So what do you need?
I'm sorry?
What do you need?
I need another one of me.
Where are the gaps that you see?
So for the McCabe Connection Center, what we're going to do is we're going to push into some of our other communities. We're going to drop our clinical specialist a half a day a month in Gifford and a half a day a month in Wabasso, and the same with our benefits specialists. So we're going to try to expand. We can't always bring the people to us, but we will bring us to the people. So we're going to start that. But as you know, this is not a growth opportunity. You know, we lose money we lose money in every patient, but we'll make it up on volume kind of joke. So this is not really a growth opportunity. So we're going to start there and see if we can get that successful. If there is a great need and we need to add somebody else to the team, then I'll come back and let you know. But so far, that's not the case.
Do you have trouble getting people, your person that gets people signed up for Medicaid or hospital district, all right, is it a struggle? I mean, I understand the time frame issue and all that, but
Right.
just,
So yes, it does go, particularly for Medicaid, food stamps, all that's easy. Hospital district, that's a seamless process. The Social Security disability applications, it can be onerous, and you develop your reputation. You know, you're a SOAR trained, so you are a sub-agent of Social Security, really. I mean, you're acting as an agent for them. So as your applications continue to go through the local offices and the judicial review committees, and they see your name and they see the quality of work you do, the longer you're at this and the better your applications, the better the turnout usually. And that's what we're really starting to see. Is she's been doing this almost 2 years now, pushing 18 or over 18 months, and she just does quality applications. They're seeing her good work, and we're seeing great payoff.
that's good.
Yeah.
That's awesome.
When you move into Gifford and Wabasso, do you have a place you're going to go? Or are you going to use the mobile unit, or are you going to use some facility?
We are going to use the mobile unit. That's one of the options, or that's one of the things we're going to do. But we're also partnering with Kindergarten Readiness, and we're going to team up with them too.
Good.
Because we're going to go with people that already have established audiences, so that we don't have to
Wonderful.
drum up the business.
Yeah,
We'll just sit.
Absolutely. Good.
Yeah, so we just continue to partnership like that.
Thank you.
Thank
for
you.
Putting together the other information on age and.
Oh, yes,
that
yeah.
one, too. Yeah.
Which was, it was really interesting. I haven't run this information in a while. So the people in the McCabe Connection Center, it was 55% women and 45% male, which is a little surprising because women access services more readily in general than men, mental health services. So it was almost, 55-45 was pretty close. Also, 80% of the folks, rounding, 80% of the folks at the McCabe Connection Center were between the ages of 19 and 64. And then 10% were below 18 and 10% were seniors. So,
That's interesting.
yeah.
I just,
Great. Thank you.
Thank you. Appreciate it, Brett. Keep doing the good stuff you do. And now Vicki, Treasure Coast Community Health.
Hi. Thank you so much for inviting me to come for our 6-month report. Treasure Coast Community Health, as you know, has a different fiscal year than you all. So the beginning of your fiscal year, the first quarter, is actually our last quarter. So the data I will be sharing for 2018 is reflected at the end of December. So, yeah. Yes, sorry. No. Because I sit back there all the time, I'm always jealous that I can't see everything. I got the clicker. Okay. So, let me see if I can manage the clicker.
You are in control now.
So you all know that we provide primary care services, medical, dental, behavioral health, and supportive services such as pharmacy and case management, with the mission being accessible, cost-effective primary care in a high-quality way for everyone, regardless of their socioeconomic status. And in years and years and years past, since this is starting our 26th year, people really think about low income, and that certainly is the mission of federally qualified health centers. But as we've heard more about the Alice report and the changing demographics of our community, not always positively, the reality is that we can all identify someone we know who is presumed to be well off, and yet if you were to open up the refrigerators, as Anne-Marie shared with us once, and look inside, you're surprised and perhaps appalled at how little there is there. And we're finding that many of our seniors, as they become widows or widowers, and their income is cut in half, find themselves in the very uncomfortable dilemma of having to sell the house in order to make it more affordable. And easier said than done, actually, for many folks. Their children are away in other states, not there as an advisor. And so you will see that while we accept all insurances, at the very bottom of this slide, we have opened up a new care area at 37th Street, right at the end, close to the Barber Street Bridge, with the idea that we wanted to stretch a little bit and have a spot that's for adults only, and not necessarily for those that are trying to cram a doctor or dental appointment between 2 part-time jobs, but rather those that think, I need care, but where can I get it? And there is a real sense of pride in our generation in terms of, I don't know that I want to go to public health. And so I would encourage anyone who is in need of medical or some behavioral health services. We all have crises in our lives, no matter our age, our ethnicity, or our race, things that are unexpected and difficult to deal with. So we have placed behavioral health folks there, great counselors. If you need a little medication management because you know that you have a history of mental illness, come on board as well. Because we have added care providers. You'll see that in addition to the list that I produced last time, we have added additional medical providers, physician assistants, and advanced practice people. We have a new advanced practice RN who is able to both listen as a counselor and prescribe medications, as well as 3 new counselors and a new hygienist. So in all the services, my motto is if you aren't moving ahead, you're going backwards. So you'll hear a little bit more about that. But I know everyone's always interested in counts. So you will see that we increased our total patient count by about 2,500 this last year, well, maybe almost 2,000. While the income brackets have not changed substantially, we do find that there are more folks that are asking how and why do you expand? How do you know when to expand and what's the process? And it's pretty simple. If we can't fit you into the schedule within a week or 2, then we start looking for more providers for that particular service. And once the rooms are full, again, using sort of a crazy 8-ball device, it's part scientific and part guesswork on our part. We then say we need another space to provide care, and in what area and where's the greatest need. So our programs have also helped us with bringing more people in. We started Just For Me program for our teenagers. The Florida legal statutes say that children between the ages of 13 and 19 are allowed to come for family planning, STD identification and treatment, or behavioral health crises without their parents' consent. And I know that makes all of us very nervous, particularly those of us that have younger teenagers. Those of us that have raised one batch realize that they'll survive, even if we don't hold their hand through every new experience. So these are available for our kids to come in and just get some solid advice from professionals. It doesn't mean that you have a bad situation going on in your family and you can't talk to each other. It just means we're here for you, and there's no charge, there's no accountability to anyone but you. So we're not going to be held up with screaming parents that say, you have to tell me.
Do they make that known in the schools?
We are starting to now.
I was just gonna ask the same thing.
We've done some presentation in the Sebastian area, have not yet gone into the Vero area. My belief is because it is not the norm, we're going at this so we can sort of debug it at the same time. It is not for folks to bring their children in because it's cheaper than insurance. Okay, it truly is a teenage program, and we hope to expand it then into more of a teen sharing club, but at this point we're just opening the resources to them at no charge. And since we're on every bus line, that eases some of the transportation issues. We also are doing a lot of work with our Accountable Care Organization, a group of federally qualified health centers, and we have been assigned about 900 seniors that have what they call straight Medicare, and those individuals are part of population health measures, and so we compare and compete actually to see who can do the best job in various quality measures. And while it is measuring those folks from 65 to 110, the reality is that those same techniques are used for all of our patients then. So it really is a win-win. We joined this group 2 years ago. It was the last year of their 3-year contract with CMS for a shared savings amount. And we realized about $40,000 out of that shared savings in 1 year. Now, this next 3-year is the last time we will have a shared risk-free ACO. CMS will now be not sharing equally just the profits, but if there are any losses on our part, then we will owe that money back. So again, it's a learning curve as a carrot, but now we have a little bit of the stick as we transition from fee-for-service into a value-based organization. And we have been accredited as a patient-centered medical home and patient-centered dental home for 3 years, and we're coming up for a renewal this summer. Patient satisfaction surveys, the long orange lines are the horizontal expression of great service on a survey. The blue lines are good service, and then those little blue and purple ones are those efforts that, even though they're little lines, get most of the attention in our organization because those are opportunities for improvement. We know we can't please all the people all the time, but we really drill down into why someone might judge that we don't take enough time with them or we're keeping them in the waiting room too long. We really look at the data and the comments as well. And so for both quarters, just as we reflected at our last get-together here, about 88 to 93% of our people in any given month say, yes, I would refer you to friends and family. And we know separate surveys that we do from a marketing point of view, which asks, how did you hear about us? Again, is overwhelmingly friends and family, trusted resources that say, yes, this is a good thing for you to do. So we do, as I mentioned, a number of quality measures. A lot of them are based on HRSA requirements of reporting, since we do get about 20% of our funding from them. And it, as you can see, is based on a number of different things and a number of things within them. And they change from year to year, but these are the ones that are sustaining from 2018 into 2019. I have told you all the happy news at every meeting. I'm going to spend just a few minutes. I know that I don't talk quite as fast as Brent, so I'm going to purposely slow down here so you can ask questions. Life is not always rosy in healthcare, and we all know that. On the outpatient side, it's getting much more challenging, particularly here in Vero Beach. The lack of available professional staff we've talked about for a long time. Everybody wants to come here to vacation. Those folks who have families want to raise them here. Young people call this Zero Beach still. It's harder to recruit them and to retain them. But we are compounded now with the challenges of the insurance companies who are taking anywhere from 3 to 8 months to credential people. And so if you are not approved as a provider by every insurance company, you don't get paid by every insurance company. And being patient-oriented, I said, well, if Dr. So-and-so isn't credentialed with this particular insurance and this patient really needs it, we're going to do it anyways. And my staff, who are very good at detail, said, yes, but you realize that we can't do referrals under that insurance company, and they can't get their prescriptions filled either without paying cash. And so they really got a lot of us over a barrel right now. That has been compounded in this last couple of months by the statewide change of the Medicaid plans. The state outsourced their Medicare work 6 years ago with a 5-year contract, and the new plans rolled out in December. We were one of the last agencies affected by region with the first rollout, so we have the honor of being in the first chute this time around. And the Medicaid plans clearly didn't get it the first time around. 45% of our patients are Medicaid, and we're doing a huge amount with claim denials, claim rework, and slow or no reimbursement. It has really desperately affected our cash flow. The economic recovery in Indian River County is a great thing for everyone, including our staff that are saying, I can get a job right next door for $2 or $3 more. So it's having an impact on us in terms of recruitment and turnover of our staff, and I'd love to give them all a $2 raise, but go back to the preceding impact, and you know why it hasn't happened yet. We're also seeing no-show appointments, which is causing, again, the lack of expected revenue, and we're working diligently to find the middle ground. We have increased the 4 ways that we contact people before their appointments: by text, by email, by phone call. I think neighbor to neighbor sometimes, so that people don't forget, and we try to remove all the barriers, but the reality is we can't have physicians sitting there 30% of their day with people not coming in, even though it looks like they were booked. So we're taking some action in terms of expectations and education with our patients, which again is a change. It's kind of holding their feet to the fire a little bit. You don't automatically get 3 appointments out with your counselor. If you miss the second one, you may be coming in on a walk-in basis instead of an appointment basis. And the lack of patient fiscal knowledge is probably the toughest one as we transition in this community to all of these different types of things that we're looking forward to. The expectation that lower income people, not just indigent, but lower people income, should get health care automatically free from everybody that they want is really causing us, again, a lot of heartburn. Because nobody can give it for free. And I explained to them, you can't go to the grocery store and get a loaf of bread and not pay. Food is just as essential as health care. The rules have to be the same. You have to put something towards it. So again, we've done some things to carrot and stick. We've offered write-offs for folks. If they pay their existing balance, we'll give them a 25% discount. There were a few that took us up on that. There are also some folks that just need to make payments, whether it's $1 or $2, and we encourage them to do it. But again, it's a mindset that the community, in watching all of these changes with Cleveland Clinic and what the hospital district is doing, the expectations are a little confused right now. So where does our money come from? 73% of our budget comes from patient revenue. 24% of all patients are self-pay. The rest comes from insurances, and we take just about everything, including what I call healthy incentives from Medicaid, Medicare, private insurances, where, again, if we meet quality measures, satisfaction, reduction of the cost of care, et cetera, they will give us a small incentive. So that adds into our patient revenue. We have a 340B pharmacy that, again, we get discounted prices. We pass a lot of that on to our patients, but it also adds to our revenue so we can pay for our pharmacy folks that are actually doing the distribution and following the regulations. We also provide hospital services up at Stewart Hospital for GYN surgeries and medical inpatients by Dr. Siddiqui. Non-patient, Stewart, I'm sorry, it was a typo.
That's okay. Because
Thank you.
It is a little confusing. I was wondering where that hospital was.
Yeah, I had
Just a typo.
SRMC
It's
to
a
start with, and I thought I was being clever. Non-direct patient service income, 20% of our budget comes from federal grants. They also offer at different times competitive grants to expand services that we offer. Thankfully, you all help us with now a 4% of our budget. We also get a low-income pool fund like the hospitals do. The state gives us vaccines for children, and they've started a vaccine for adults program that we have enrolled in. And although we have a few great donors on an individual basis, Johns Island Community Service League has been responsible for funding most of our Women's Health Fund for the past 3 or 4 years, and the Johns Island Foundation helps all of us with the capital needs, and then fundraising. So these are numbers that you all can take a look at your leisure. The top 2 rows are what we submit to you all, and the bottom 4 are the comparatives back to our population as a whole. You'll see that there has been an increase in medical services, as your budget reflects in the handout you gave today. Behavioral health services are also increasing, but not as rapidly. And the dental services actually had a decrease in the hospital district folks, while our others remain stable or a slight increase. Part of that, again, I can't explain why the difference in the 2 populations. I can tell you that we did have problems in recruiting and retaining dental assistants the last quarter of 2018. We have been able to fix that, and so now we're really filling up quickly. So you will see that change.
I ask you a question on these
Sure.
numbers, and maybe I'm not looking at it correctly, but if I look at just your medical services, the district qualified, you had in the last quarter 900 some that were district qualified patients out of 11,900, right?
Correct.
81% were at 150% or less of your 11,900 patients, which would say they should, 81% should
Doesn't
qualify.
mean that they qualify for the district, because the district is Indian River County residents only. And we, because we have 2 centers on the edge of our county borders, we see quite a few patients from Palm Bay and other Brevard County, as well as Lakewood Park and other Fort Pierce people come in. So they don't qualify. They also don't qualify if, as you know, they've spent less than 6 months within the county. Okay, so even if they moved over, they're still within the 150, but they don't qualify by residency.
And
We do look at
and
those.
You think that's the major 2 reasons why?
Absolutely.
That's a big difference.
It is.
Yeah,
It is.
okay.
Yeah,
Right.
and we go through every application for sliding fee scale as well as the hospital district several times, don't we, ladies? So I'm pretty sure of these numbers.
Well, I'm not questioning your numbers, I just didn't understand why
That's why.
such a big percentage of them did
Yeah.
not qualify, so.
You know, and I would say that probably 15% of our total come from outside of the county and disqualify because of that. But the rest of them are definitely because they can't prove that they've been within the county for 6 months.
Well, I think Mary Beth raises a really good question. But as I look at this, it looks to me like the percentage of uninsured patients is only 20%.
On medical
So
services
that would mean
for us.
80% have some form of insurance. At least that's the way it appears to me.
That's
So
true.
that would be a big
That's true,
factor
too.
as well.
Mhm. That is absolutely true. And part of that, again, you can have insurance and then you can have insurance. Many of our insurances, as we've talked about, have such high deductibles these days that
It's useless.
It's really catastrophic.
it is.
Agreed.
It's really difficult.
But it is disqualifying for district coverage right now.
Exactly, exactly.
Okay, so we're talking about that.
And I appreciate that, as do, I'm sure, the patients that are in that situation. And that's why when we talk about getting federal funding covers these people that the district does not, that are low income, below 200%, but they can't qualify for these various buckets. They can't get Medicaid, they can't get into the district because of one of these two reasons, okay? So we're happy to help them, but it does stretch our dollars quite a bit. And then the summary district reimbursement year-to-date, then, as you pointed out, we're below in 2 of the 3 categories by about $79,000 in total. So that will be changing, because I'm getting the word from my dental director. Yeah.
Yeah, they're starting to come.
Yeah.
It's interesting. I mean, this is a lot of good data here to understand, so.
Well, I'll be happy to drill it down for you anytime. Just give me a call. But I'm conscious of time. Thank you all very much.
Thank you.
Thank you, Vicki, appreciate it.
Excuse me, I just have one question for you. Your mental health program, where your suicide prevention,
Yes.
are you working with the VA on that?
We are, and I'm so glad you asked, because I kind of skipped over that additional program work. We signed an agreement with Tri-West, and we have been seeing behavioral health patients at our facilities now for about a month, and they just approved us to go forward with some medical care. So we've been working with the Veterans Council, with Marty Zickert. We're starting to really get the word out. They've got to have a pre-authorization from the VA services because of the hardship
Yeah, well,
of
they're
being
working
seen
on
in
it.
town.
Plus, under hardship, you have to be more than 40 miles away, and it just happens that we're 80 miles away from West Palm. So but they're reticent to give up their patients at West Palm. And that we are working on that, trying to get
Well, it's actually
more
West
reasonable.
Palm that involved us. They have a suicide task force, and we joined that by invitation. And we have been working as a corollary to that with Cleveland Clinic Indian Rivers Behavioral Health Center on their suicide survivors, the overdose folks, because we have been really active with Vivitrol and other medication-assisted programs to really give people a second, third, fourth chance, whatever, because these are our friends, our relatives. We're not ready to give up on them, and there are great tools out there. You just have to be present at that right moment, and so those programs are dovetailing very nicely.
Thank you very much.
Thank you.
Actually, can I ask you a question about the Medicaid
I'm
service?
just going to stay up here for a little bit.
Poor woman, we're not letting her escape.
We don't have a very big agenda tonight.
No, it's fine. I love the
Somebody said they want to be
questions.
out here by 5:45, and I'm trying to prevent that.
It doesn't mean we
But-
have to take long.
No, I'm interested in the slowness of credentialing people, and is there anything the district can do to assist you? We pay for the county a substantial amount to Medicaid every year to supplement.
Yes.
So I don't know if there's any way that we could have any effect there, or if you can think of a way that would be helpful to you and other agencies that have the same problem.
Well, the agreement was supposed to be this time around that if they didn't credential providers within 60 days, which everyone agreed was a reasonable period of time, because these are all Florida licensed physicians,
Right.
and they're all credentialed by their individual agencies, by their medical peers as well. So this is just an additional layer that postpones payment. It's another tool in their keep the funds here as long as possible, in my opinion, in my humble opinion. There are some Medicaid agencies that are better than others. We have 5 within our district, or in our region, actually. The biggest offender is having a conversation with the Florida Association of Community Health Centers, but I think we're probably going to end up having to call ACA directly, and so I will keep your phone number nearby.
But it happens throughout.
It does.
If a physician leaves one practice and goes to another practice, he has to start all over again with a different, it is what it is, and yes, it takes a lot of lobbying to get that
The
changed.
terrible thing is the
Because
impact it's having on patients now. What they did is ACA rolled out an auto registry, and they had addresses from 6 years ago for these patients, and they cannot get them changed. Therefore, they're auto-assigned to a physician, often out of county. In my own case, my 9-year-old keeps being claim denied because he was in Hollywood, Florida, 6 years ago. And I've spent hours on the telephone, and you would think, you know, that I might have connections and they might listen to me. It's not happening. It is not happening. And so I really feel for all the individuals.
Right.
Because we can't, as organizations, we can't change it for them. So they get on the phone to try to make that change. And then we're telling them, sorry, it didn't work, call again. And so many of these people are very, very, very frustrated, and they think it's us, and it's not. It is just a really bad situation for everyone involved.
Vicki, I can understand your frustration. It's been over 20 years since I had to deal with Medicare and Medicaid in New York. And they were absolutely awful. Their thing was to keep the money as long as possible, no matter what it was, and all types of pretexts that were absolutely ridiculous. And at one time, I had my state representative call them directly on the phone. I was there. And the guy's attitude, who the hell are you? Well, I'm the state representative. Too damn bad. We don't have to listen to you. And that was their attitude. And I understand completely what you're going through, and I feel for you.
We can get our mayor
Frustrating.
on it.
We can't get them to do what they're supposed to do.
Oh, my goodness.
I was just going to say, I have personal experience, if you want me to say it.
Sure.
With dealing with that, and one of the most, for Medicare and Medicaid, one of the most useful people to call is Congressman Posey's office. He's been very helpful for me for getting like new doctors
Credentials.
expedited.
Right.
At the state level.
Well, no,
At the,
I was saying Medicare.
Yeah, Medicare has not caused us that kind of pain, but Medicaid definitely has. So I appreciate your support in that. Thank you.
Thank you.
thank you.
Anything else?
Well, I just want to, I mean, I hate to say this, but could I conclude from this that government insurance for all might not be the panacea some people think?
Oh, don't you understand?
Sorry.
It depends on who's regulating it,
You're not listening to the
how
politicians.
political it is.
Vicki, you're doing a
Surprise.
wonderful job in the community.
Thank you, Vicki, we appreciate it. Okay, any unfinished business with the trustees? New business, I just want to mention, I think everybody's kind of read about, again, the countywide needs assessment that is just starting, that the Community Foundation and United Way and are working on in every kind of, from a needs assessment, not just health, but housing and everything else. So we're going to stay in tight touch with that too, because I think that's going to be a very wide awakening for the county to see what it really is. So we'll stay in touch with that. Any other business? I'm almost afraid to say it. Any public comment? Okay. All right, thank you very much, and meeting is adjourned. Almost your quarter to. It was almost.